Did you know that over 25% of adults worldwide are living with a dangerous health condition without even realizing it? It's called fatty liver disease. A silent killer that can lead to a range of problems like diabetes, high blood pressure, and even cirrhosis. But don't worry. In today's video, I'll help you identify the 8 most clear signs to know if you might be facing this condition. Watch the entire video to understand your body better and prevent potential risks early on. Poor nutrition, characterized by high intake of omega-6 fatty acids, sugar, and alcohol, is a primary contributor to inflammation and fat accumulation in the liver. Modern lifestyle choices, such as consuming processed foods, alcohol, and high fructose corn syrup, have led to an increase in the prevalence of fatty liver disease, while external factors like medications, chemicals, and viruses play a secondary role. They remain important considerations. Ultimately, fatty liver disease arises from a combination of lifestyle, dietary, and environmental factors. 1. Right shoulder pain. Fatty liver disease can cause right shoulder pain due to the liver's role in bile production and its connection to the phrenic nerve. The liver produces bile to aid in fat digestion. When the liver is affected by fatty deposits, bile can become thicker and harder to flow, leading to blockages in the bile ducts. This bile buildup causes swelling and inflammation in the liver, increasing pressure in the liver and gallbladder area. This pressure can affect the phrenic nerve, which runs from the neck to the diaphragm and connects to areas like the right shoulder, neck, and upper back. The irritation of the phrenic nerve can cause referred pain in the right shoulder or below the shoulder blade. You may experience a dull or sharp pain, often concentrated in the right shoulder, neck, or under the shoulder blade. This pain can worsen after eating fatty foods, as your gallbladder works harder to digest fat. You might also feel a sense of tightness or heaviness in your right shoulder or neck. You may experience a dull or sharp pain, often concentrated in the right shoulder, neck, or under the shoulder blade. This pain may worsen after consuming fatty foods, as your gallbladder works harder to digest fats. You might also feel a sense of tightness or heaviness in the right shoulder or neck area. Why is this symptom often overlooked? Confusion with musculoskeletal issues. Right shoulder pain is often mistaken for muscle strain, poor posture, or skeletal problems. Lack of awareness of the liver connection. Many people are unaware that the liver can cause pain in locations other than the abdomen, making this symptom easy to miss. Right shoulder pain isn't always related to the liver. Other causes can include musculoskeletal issues, muscle strain, shoulder arthritis, or frozen shoulder. Gallbladder inflammation or gallstones can also cause referred pain in the right shoulder. Lungs. Conditions like pleurisy or pulmonary embolism can cause right shoulder pain. Nerves. Nerve compression in the cervical spine can also cause pain radiating to the shoulder. Distinguishing features of pain caused by fatty liver disease. It's accompanied by other symptoms like fatigue, indigestion, itchy skin, or abdominal weight gain. The pain is often associated with consuming fatty foods. Right shoulder pain is not just a musculoskeletal issue, but it could also be a sign of liver damage. If this symptom appears alongside other signs of fatty liver disease, it's important to take it seriously and seek medical attention promptly. 2. Abdominal obesity. The link between belly fat and fatty liver disease is complex and multifaceted. When the liver is affected by fatty liver disease, it struggles to process and metabolize fat effectively. This leads to an accumulation of excess fat within the liver initially. As the liver's storage capacity becomes overwhelmed, the fat spreads to other areas, particularly the abdominal region. Visceral fat. The type of fat surrounding internal organs in the abdomen plays a crucial role in this process. unlike subcutaneous fat, which lies beneath the skin. Visceral fat not only contributes to an increased waistline but also triggers inflammation and disrupts organ function. Fatty liver disease is often associated with insulin resistance, a condition where the body cannot utilize insulin efficiently. This leads to excess blood sugar being converted into fat and stored in the liver and abdominal area, further contributing to belly fat accumulation. Having a large belly is a serious health concern because it indicates an accumulation of visceral fat, which is more dangerous than subcutaneous fat. Visceral fat not only takes up space in your abdominal cavity but also releases inflammatory substances called cytokines, increasing your risk of heart disease, diabetes, and high blood pressure. It can also disrupt the function of internal organs like the liver, kidneys, and intestines. This condition is often linked to metabolic syndrome, characterized by high blood pressure, high cholesterol and triglyceride levels, and high blood sugar. These factors contribute to the development of fatty liver disease and heart disease. A protruding abdomen, often referred to as a beer belly, is characterized by a noticeable bulge in the midsection, even without excessive food intake. This can lead to abdominal discomfort, as the pressure from visceral fat can cause feelings of heaviness or bloating. Additionally, the accumulation of fat in the abdomen can make movement more challenging, particularly when bending over or engaging in strenuous activities. Understanding the difference between belly fat due to fatty liver and other causes. Belly fat due to nutrition. This is often linked to unhealthy eating habits, consuming excessive calories, and a lack of physical activity. Belly fat due to metabolic disorders. This type of belly fat is accompanied by other symptoms such as high blood sugar, high cholesterol, and high blood pressure. Belly fat due to fatty liver disease. In this case, belly fat can occur even without consuming a high-calorie diet. It is often accompanied by symptoms like fatigue, itchy skin, or right shoulder pain. Key difference: belly fat due to fatty liver disease tends to be associated with metabolic and overall health issues, going beyond a simple aesthetic concern. Several factors can contribute to the worsening of belly fat. A diet high in sugar and saturated fat, such as fast food, sugary drinks, and fried foods, can lead to the accumulation of visceral fat and fat in the liver. A sedentary lifestyle reduces the body's ability to burn fat, resulting in fat accumulation in the abdomen and liver. Chronic stress can increase the hormone cortisol, which promotes fat storage in the abdominal area. 3. Flank pain. Right-sided rib pain caused by fatty liver can be due to several factors. One common cause is bile sludge, which occurs when the liver's production and flow of bile are disrupted. This can lead to thicker bile and the formation of cholesterol fragments called bile sludge. This buildup can put pressure on the gallbladder and bile ducts, causing irritation and pain near the liver. Inflammation of the gallbladder or liver, which can be caused by fat accumulation in the liver, can also lead to right-sided rib pain. This inflammation increases pressure on surrounding tissues, including the muscles and cartilage between the ribs. Another possible cause is costochondritis, an inflammation of the cartilage connecting the ribs to the breastbone. This condition can be triggered by pressure from a swollen liver or inflamed gallbladder, leading to pain when touched or moved. The pain is typically located in the upper right abdomen, near the liver, and may radiate to the back or right shoulder. It can be described as a dull ache, sharp stabbing pain, or a feeling of tightness in the right rib cage. The pain may worsen with deep breaths, twisting movements, or after consuming fatty foods. The pain may occur after meals, particularly those high in fat, or it may appear suddenly without a clear cause. Indigestion can be accompanied by symptoms such as bloating and discomfort after meals due to interrupted bile flow. Nausea or vomiting may occur if the gallbladder or liver is severely inflamed. Pain may worsen when sitting for extended periods, as increased pressure on the liver and gallbladder area can exacerbate discomfort. Why is this symptom often overlooked? Confusion with musculoskeletal issues. Right-sided rib pain can easily be mistaken for muscle strain, postural pain, or muscle inflammation. Related to digestion, some people attribute the pain to their stomach or intestines without considering the liver. Right-sided rib pain due to fatty liver can be distinguished from other causes by its association with digestive and metabolic symptoms such as abdominal obesity, fatigue, or indigestion. Fatty liver disease can cause right-side rib pain due to several factors, including a high-fat diet, excessive sugar and refined carbohydrate intake, and a sedentary lifestyle. 4. Spider veins. Spider veins can form due to increased estrogen levels in the body. When the liver is affected by fatty liver disease, it can't effectively remove excess estrogen. This leads to higher estrogen levels in the blood, which can weaken blood vessel walls and cause them to dilate, resulting in spider veins. Additionally, liver damage can affect blood flow in the portal vein system, increasing pressure in the veins and causing small capillaries on the skin to dilate. Spider nevus, also known as a spider angioma, is characterized by a central red or purple spot from which small blood vessels radiate outward, resembling a spider web. These lesions commonly appear on the face, neck, chest, or arms. Their size can vary from a few millimeters to larger dimensions, depending on the severity of liver damage. Spider veins are an early warning sign of fatty liver disease. They often appear before more serious symptoms of liver damage, such as jaundice or swelling, become noticeable. These veins are a sign of impaired liver function. When the liver doesn't work effectively, toxins and hormones aren't properly removed, leading to imbalances and damage to blood vessels. Spider veins often don't appear alone, but are accompanied by other signs of fatty liver disease or liver damage, including chronic fatigue. This can be caused by a reduced ability to remove toxins and absorb nutrients. Itching. This is related to the buildup of bile and histamine in the blood. Swollen legs or abdomen. This is caused by pressure in the veins and fluid retention. Jaundice. This is due to bilirubin not being effectively processed by the liver. Spider veins can be caused by factors other than fatty liver disease. Here are some common causes: hormonal changes, genetics, aging, and mechanical pressure. Spider veins caused by fatty liver disease are typically located on the upper body and are often accompanied by other symptoms related to liver dysfunction. The presence of spider veins can be an early warning sign of liver damage, such as hepatitis, fatty liver disease, or cirrhosis. If spider veins are numerous and widespread, it may indicate severe liver damage and prompt medical attention is necessary. 5. Gynecomastia in men. Fatty liver can lead to breast enlargement in men due to its role in hormone metabolism. A healthy liver effectively eliminates excess hormones, including estrogen and testosterone. However, when the liver is compromised by fat accumulation, its ability to remove estrogen is impaired. This results in elevated estrogen levels and a decreased testosterone to estrogen ratio, disrupting the hormonal balance. The excess estrogen promotes breast tissue growth, leading to enlarged breasts. Meanwhile, reduced testosterone exacerbates this condition by further disrupting the delicate hormonal equilibrium. Enlarged breasts due to fatty liver disease are characterized by swollen, soft breast tissue that may be tender or sensitive to the touch. This enlargement can occur in one or both breasts. Unlike typical fat accumulation in the breasts, pseudogynecomastia. Gynecomastia caused by fatty liver disease tends to involve more breast glandular tissue than excess fat. Enlarged breasts in men with fatty liver disease often come with other signs of liver damage, including spider veins, caused by high estrogen weakening blood vessels, swollen legs or abdomen, due to pressure in veins and water retention, chronic fatigue, as a weakened liver struggles to remove toxins effectively, and itchy skin or jaundice, related to bilirubin and bile buildup. Enlarged breasts in men can be caused by various factors besides fatty liver disease. It's important to differentiate between these causes: hormonal imbalances, Klinefelter syndrome or other genetic disorders causing testosterone deficiency. Side effects of medications, certain medications like antidepressants, stomach suppressants, or steroids can disrupt hormone balance. Obesity, excess fat in the chest area can create a similar appearance but is not hormone related. Alcohol consumption, alcohol affects liver function and can contribute to gynecomastia. Gynecomastia due to fatty liver disease often presents with other symptoms of liver damage and can occur even in individuals who are not obese. The clinical significance of a warning about impaired liver function. The appearance of gynecomastia indicates that the liver is no longer effectively processing hormones, particularly in cases of fatty liver disease that has progressed to cirrhosis or hepatitis. Regarding metabolic disorders, hormonal imbalances can lead to other issues such as decreased libido, muscle weakness, or difficulty concentrating. 6. Right leg swelling. Fatty liver disease can lead to swelling in the right leg due to several factors. The liver plays a crucial role in producing proteins and regulating blood circulation. When the liver is damaged by fat accumulation, it can affect these functions, leading to swelling. One reason for swelling is a decrease in albumin production. Albumin is a protein produced by the liver that helps maintain blood pressure and prevents fluid from leaking out of blood vessels and accumulating in tissues. When the liver is damaged by fatty liver disease, albumin production decreases. This can cause fluid to leak from blood vessels into tissues, leading to swelling, particularly in the legs, especially the right leg. Swelling is often more pronounced in the lower extremities due to gravity. Another factor contributing to swelling is increased portal vein pressure. Fatty liver disease can cause increased pressure in the portal vein system, which carries blood from the digestive tract to the liver. This can reduce blood flow from the legs back to the heart. The resulting blood stagnation in the leg veins, particularly on the right side, can lead to more noticeable swelling in that area. Finally, fatty liver disease can lead to bile duct blockage or cholestasis, causing inflammation and pressure in the liver. This can affect the liver's ability to filter and circulate fluids, leading to fluid retention and swelling. Right foot swelling is characterized by swelling that typically appears around the ankle, the top of the foot, or the entire right foot. When you press on the swollen area, an indentation will remain for a few seconds before returning to its normal shape, known as pitting edema. You may also experience a feeling of heaviness, discomfort, or tightness in the swollen area. Swelling is often more noticeable at the end of the day or after standing or sitting for long periods. Swelling in the right leg due to fatty liver disease often doesn't occur in isolation. It's usually accompanied by other symptoms of liver damage, including fatigue. This can be caused by the liver's inability to effectively remove toxins and provide energy. Jaundice. This occurs when bilirubin builds up as the liver's function declines. Itching. This is linked to bile stasis and histamine accumulation. Abdominal swelling, ascites in more severe cases. Fluid can build up in the abdominal cavity. Why is this sign often overlooked? Confusion with other causes. Leg swelling is often attributed to other causes such as heart disease, venous insufficiency, or prolonged standing/sitting. Lack of pain. Liver-related leg swelling usually doesn't cause significant pain, making it easy to miss. Swollen legs can be caused by various factors, including heart failure, venous insufficiency, kidney failure, allergies, or injuries. However, swollen legs due to fatty liver disease are distinct. While other causes often involve localized inflammation or mechanical factors, fatty liver disease-related swelling is associated with decreased albumin levels and increased portal vein pressure. Swollen legs, particularly the right leg, can be a sign of severe liver damage. This indicates that the liver is significantly impaired in its ability to produce albumin and regulate blood circulation. If left untreated, fatty liver disease can progress to cirrhosis or liver failure, leading to more serious complications. It is important to seek medical attention if you experience this symptom. 7. Itchy palms/feet. Liver disease, such as fatty liver, can cause itching in the palms and soles of the feet due to bile buildup, toxin accumulation, and inflammation. Itchy skin can be a symptom of fatty liver disease. The itching is often concentrated on the palms of the hands and soles of the feet, but it can also spread to other areas. The itching tends to be worse in the evening or at night, likely due to increased activity of the autonomic nervous system. The itching is usually intense and doesn't come with a noticeable rash. However, constant scratching can lead to skin abrasions and redness. Itching due to fatty liver disease is often accompanied by other symptoms, including jaundice, yellowing of the skin and eyes due to increased bilirubin in the blood, chronic fatigue due to the liver's inability to effectively filter toxins, dark urine as a result of bilirubin not being properly metabolized, swelling in the legs or abdomen due to reduced albumin production, pain in the upper right abdomen related to hepatitis or bile duct obstruction. Itching can be caused by fatty liver disease or other conditions. Liver-related causes include primary biliary cirrhosis, a condition that damages bile ducts, and alcoholic hepatitis, which can cause bile buildup and itching in later stages. Non-liver-related causes include allergies or rashes, skin conditions like eczema or psoriasis, and kidney failure. Itching from fatty liver disease is often localized to the palms and soles of the feet and does not usually involve a rash. Itching of the hands and feet can be a significant clinical sign, potentially indicating serious liver damage. This symptom arises when the liver struggles to process bile and toxins, raising concerns about the progression of fatty liver disease to hepatitis or cirrhosis. Intense itching, particularly at night, can disrupt sleep and lead to psychological distress, impacting quality of life. 8. Persistent fatigue. Fatty liver disease can disrupt thyroid hormone metabolism, leading to hypothyroidism. The liver plays a crucial role in converting inactive T4 into active T3. However, in fatty liver, impaired liver function reduces this conversion, resulting in T3 deficiency and slowed metabolism. Additionally, elevated lipids in fatty liver can interfere with thyroid function, creating a vicious cycle. Chronic inflammation and oxidative stress associated with fatty liver can also negatively impact thyroid hormone production and activity. Hypothyroidism can lead to fatty liver disease, often accompanied by fatigue and slow metabolism. Common symptoms include unexplained weight gain, persistent fatigue, dry skin and hair loss, cold hands and feet, and a slow heart rate. Hypothyroidism can be caused by fatty liver disease and other factors. Liver-related causes include chronic hepatitis or cirrhosis, where severe liver damage can lead to hypothyroidism. Lipid metabolism disorders, such as high cholesterol, are associated with hypothyroidism and can worsen fatty liver disease. Non-liver-related causes include iodine deficiency, which is the most common cause of hypothyroidism. Autoimmune disorders, such as Hashimoto's thyroiditis, occur when the immune system attacks the thyroid gland, reducing hormone production. Some medications, such as lithium and amiodarone, can also affect thyroid function. Hypothyroidism due to fatty liver disease is often accompanied by signs of liver damage, such as fatigue, abdominal bloating, and jaundice. The clinical significance of hypothyroidism in non-alcoholic fatty liver disease, NAFLD, highlights a serious risk of liver dysfunction. Hypothyroidism indicates that the liver is struggling to perform essential metabolic functions, particularly the activation of thyroid hormones. This combination of NAFLD and hypothyroidism can increase the risk of developing complications such as obesity, diabetes, and cardiovascular problems. The connection between the liver and thyroid, a dangerous cycle. Hypothyroidism slows down metabolism, leading to increased fat accumulation in the liver. Fatty liver, in turn, reduces the conversion of thyroid hormones, worsening hypothyroidism. This creates a vicious cycle, increasing the risk of chronic diseases such as diabetes and cardiovascular disease. As you see, fatty liver disease is not a simple issue. But the good news is that it can be prevented and reversed if we act promptly. If you notice any of the 8 symptoms I just shared, don't hesitate to seek medical advice. More importantly, start making lifestyle changes today to protect your liver, the organ that works tirelessly to keep you healthy. Don't forget to like, subscribe to the channel, and share this video with your loved ones. Together, we can build a healthier body and a better life. See you in the next video.